Namaskar. When it comes to developing communication, especially with children having multiple disabilities, which would be including children who are having cerebral palsy, autism, and other cognitive delays, the major challenge of the speech therapist is to get the attention of the child. The attention of the child is something which is very essential because communication means there will be two people. One person speaking, the other person hearing. The person is speaking about something which is common between the interests of the speaker and the listener. The listener hears it and gives the feedback. So communication is a two-way active process in which both the listener and the speaker exchange their ideas about a particular topic. When two people tend to fix in their ideas upon one thing, the attention or the type of attention is known as joint attention. Joint attention is one of the most essential things which is required for communication to happen, even for communication or speech development to get initiated. The major challenge while working with children having multiple disabilities, specifically autism, is we do not get a joint attention from the child. The child with autism usually would be either busy in stimming, will not giving you eye contact, or would be having a very fleeting attention upon things. So, the major role of a speech therapist is to get the attention of the child and establish a communication in that particular window of attention. Attention from anybody can be taken in through two ways. First, through a set of games or events which would be cognitively stimulating the person, or second, a set of games or events which would be sensorily stimulating the person. When I say cognitively stimulating the person, it may be something like a intellectual debate or a story which tickles your cognition. You want to learn, you get attracted to it. When it comes to, that's one way in which we can attract our people or children. The other way is we can get children or people attracted through sensory games or sensory activities or activities which give a lot of sensory stimulation. For example, all the rides and the swings in an amusement park which takes you round, 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 up, down, or there may be a bull on which we are sitting down, or there would be water. These all are sensory-based activities. These sensory-based activities stimulate either of your seven senses. The seven senses include 5 senses which are far senses and 2 which are near senses. We are very much aware about these 5 far senses, which include the vision, the hearing, the touch, the taste, and the smell. These are far senses because sensory input comes from outside. We cannot roll our senses inwards, these 5 senses. The other 2 senses are the senses of balance and the senses of joint sensation, the vestibular sense and the proprioceptive sense. These are known as near senses because these come from sensation of within. They are stimulated from outside, but these are near senses, these are far senses. So any set of activities which would be involving all these 7 senses or the cognitive capabilities of the child would be attracting the child. Children who are in the pre-linguistic skills or children who are severely developmentally delayed are usually attracted out with the help of a lot of sensory games. In the video which follows, we will be showing you how to establish out communication using a lot of sensory games and a few cognitive games. Once we get the attention of the child in a particular game. The therapist focuses our attention on the same activity. So we have a joint attention of the therapist, the child, and that activity, and we establish out communication during this process. Once the child learns how to communicate, we shape it up to other things. Hope you enjoy the video of sensory and cognitive games.